The Scott County Health Department will speak for Scott County. First of all, I'll start off with some Rock Island County numbers. We have 16 new cases today for a total of 12,261. We have 28 people hospitalized at this point, and we have no new deaths to report, so the number of deaths stands at 294. One other piece of information that I'd like to pass along is we have our first confirmed case of multi-system inflammatory syndrome, which is that extremely dangerous inflammation of body tissues, including the heart, lungs, kidneys, brain, and skin, and other systems, most associated with the COVID infection in children. One boy who was is in his teens has since recovered from that, but he was a very sick young man. That's all I have at this point. Ed?
In Scott County, the number of cases so far is 16,300, and our deaths stand at 182.
This is Janet again. So today we had almost 800 people get their first dose of the COVID-19 vaccine at our mass vaccination clinic at the Greater Quad City Auto Auction. This is our third clinic, and we've fine-tuned our process to get people in as quickly and as efficiently as possible. This is a massive operation, as you can imagine, and we couldn't do it without the dedicated work of our staff and volunteers. Helping us today were a contingent of Moline and Rock Island firefighters, the Rock Island County Sheriff's Department and Emergency Management Agency, nurses from Unity Point Trinity, and many members of our Medical Reserve Corps, in addition to our dedicated staff. Everyone today received their first dose of the Moderna vaccine. Supply of both the Pfizer and Moderna vaccine remain limited in our community, and in fact, all over the country. Because of the short supply at this point, the CDC researched how long the second dose could be delayed so that as many people as possible could get at least some protection from a first dose without hurting the efficacy of the second dose. Researchers determined that 28 days is the minimum interval for the second dose for Moderna and 21 days for Pfizer. But the most important point here is that people can wait up to 42 days from their first dose to receive their second dose, and that is for both vaccines. To this point, we have devised a system that will allow people to get their second dose at our mass vaccination clinics without having to compete with people wanting their first dose. Both doses will be given at the same clinic. We still are limited to about 800 doses per clinic because we are sharing our vaccine allotment from the state with our partners at Community Healthcare, Jewel Osco, and Hy-Vee. Most weeks, we have been receiving only 1,600 doses for the entire county, but we hope soon that the Illinois Department of Public Health will be able to give us more doses. People seeking a first dose need to visit our Facebook page or website, which is richd.org, at 10 a.m. each Friday for a link to the first dose clinics. A second link will be posted at 11 a.m. each Friday that same day for those who need the second dose. The second dose may not be exactly 28 days later, but we will be within those 42 days that the CDC says is possible. This is the schedule through the end of March, and there's a lot of detailed information here that will be printed out and sent in our post briefing media release. So the first dose given on January 12th, the first availability for the second dose and the number of slots. So first dose, January 12th, first availability, February 9th. We will give 450 first dose shots and 350 second dose shots. For the January 19th first dose, first availability will be February 16th with 300 first doses and 500 second doses. Also, first dose from January 19th. February 20th, that will be available on February 23rd. 400 first dose slots and 350 second dose slots. The reason why both of those are, there are 2 weeks of January 19th, is there were a lot of doses given on that day, and then the next week we had to cancel the clinic because of the snowstorm. So the first dose given on February 2nd, that is today, will be available on March 2nd. So 300 first dose slots and 500 second dose slots. February 9th, people will be given on March 9th. That's 350 first dose slots, 450 second dose. For the first dose on February 16th, it'll be March 16th, 500 first dose, 300 second dose. February 28th, March 28th, 350 for first dose, 450 for second dose. And then those who get their first dose on March 2nd will be eligible on March 30th. That is 500 first dose slots, 300 second dose slots. And just, I know that was a lot of detailed information. Again, we will send that out via email and post on our Facebook page and our website. The most important piece to understand is that you may not get your first dose at exactly 28 days, but you will be able to get it within that 42-day window that the CDC says okay. We understand that this system is not perfect, but until vaccine supply increases significantly, we unfortunately are forced to work in an imperfect system. We appreciate your patience and know we've asked for it a lot already. Please know that we are doing our best we can do to provide doses to everyone and to complete our mission of preventing disease, promoting wellness of mind and body, protecting public health, and preparing for emergencies. We are using an internet-based registration system to make this mass vaccination effort work as well as possible. We understand that our older residents might not have access to computers or the internet. We will have a solution to this problem to announce on Thursday. We are working out the final details now. Thank you.
Well, it's been 7 weeks since we first received COVID-19 vaccine in Scott County. The Iowa Department of Public Health reports that more than 12,400 doses of COVID-19 vaccine have been administered in Scott County since that time. This includes both first and second doses. Due to the time it takes to compile and publish the data, we believe this number is actually higher. We're also officially 2 days into phase 1B. The number of people eligible for vaccine in this phase is much larger than in phase 1A. As a consequence, the demand for vaccine far exceeds the supply we or any other community is receiving so far. We had 500 doses available for yesterday's clinic for an estimated population of over 25,000. Although it was anticipated, the demand caused our registration process to experience difficulties, and that caused much frustration. The enrollment process is now being evaluated and improved. We have a dedicated IT team at Scott County who are working to ensure that our site can handle the traffic in future enrollments. We will determine each Tuesday whether there will be a public clinic for those 65 and older the next week. The defining factor will be the amount and the type of vaccine we receive. If a clinic is scheduled, we will send information through our website, email listserv, social media pages, and the local media, both broadcast and print. We will also give directions on how to enroll and when. However, for the present, the amount of vaccine will remain very small and the number of people trying to enroll very large. There will continue to be intense competition for appointments and many will be disappointed. During this time, however, we expect vaccine also to be available to our healthcare partners for the 65 and older population. How that vaccine will be provided will be determined by those medical providers. Scott County Health Department will not be scheduling a public clinic for those 65 and older next week, the week of February 8th. We did not receive an allocation this week of the type of vaccine used at our clinic. As a reminder, during phase 1B, we're being asked by the Department of Public Health, the Iowa Department of Public Health, to split all the vaccine we receive weekly between that 65 and older age group and the priority groups in the 5 tiers. This week, Scott County Health Department and the Genesis Health System will begin vaccinating the pre-K to 12th grade education staff in Scott County. This is quite an undertaking and will help support the schools, many of which will be returning to full in-person education in the next couple of weeks. Our staff has remained dedicated to serving our community during this pandemic through all the challenges, the change in the guidance, the limited resources, and the tight supplies. A lot of work we do doesn't make it to the front page of the newspaper or to the 6 p.m. news. There are hours spent listening and responding to the questions and concerns of our residents, planning meetings with our partners to create and update plans, and crafting messages and directions for the community, even if the information we have to share isn't what you're hoping to hear. We are committed to this effort and will continue to serve the public in the challenging weeks and months to come.
Thanks, Janet and Ed. I'm going through here to see if we have any questions from our media partners. I know a couple of the questions on the schedule for Rock Island County's second dose clinics have been answered, as well as will be provided in the press release. Janet, a question for you here for Rock Island County. A number of readers have taken issue with the rate of vaccination, pointing Rock Island County's rate of completed doses compared to population is lagging behind other counties. Can you explain why these numbers might be different from some of our neighbors?
Each of the counties receive a different allocation, and we are keeping track through the state of Illinois system, and they are saying that we have done more than 8,700 doses as a county between the health departments and our partners. It is important to note, though, that we are not in charge of exactly what our partners do. We give them the allocation, and if they have some sort of staffing problem that day and are not able to give it, as long as it's still frozen, if it's a Moderna vaccine, it can still be used at a later date. 8,700 when vaccine is a trickle at this point seems pretty good to me. We've done a number of mass vaccination clinics where we've been able to do approaching 3,000 people, and that's to me a pretty good success story.
Thanks, Janet. I'll give it another minute, see if any of our media partners have any additional questions. Okay, not seeing any additional, we'll go ahead and conclude for today. We'll be posting the link to this recording on our website, as well as our press release on our website if you do not get those directly from us. And then we are committed to providing another update with you on Thursday, as well as all of the happenings that are happening with our clinics. Please continue checking our websites for updates and additional opportunities for vaccination in the community. Thank you, everybody, for joining us. Have a good afternoon.